Hey, thanks for joining me. I am Sylvia with Walkabout Canine Consulting, and I wanted to go through my behavior assessments that include my dynamic dog assessments. So I am Sylvia Kozrzak, and I am a certified professional dog trainer, certified dog behavior consultant, certified separation anxiety trainer, certified fear-free professional, and a dynamic dog practitioner. I've been helping dog owners for over 30 years, and I'm also proud to be helping new trainers as a Victoria Stilwell Academy faculty advisor. And I wanted just to explain some of the things that I do, as well as now as a newly dynamic dog practitioner. And what is that? You're probably wondering, which is a 4-month intensive course that is given with monthly assignments and real life case studies that have to be assessed personally by the instructor, Gemma Harvey, who teaches this course, and she is the owner of All About Dog Therapy and mainly focuses now as the founder and principal of the Dynamic Dog Practitioner Program. And these are her qualifications, as well as she has a lot of knowledge in regards to movement, structure, etc. And I took this course because I wanted to help solve more dog behavior issues with this dynamic assessment. And essentially, what I do is so it's a little bit different as I incorporate the dynamic dog protocol, which means, as usual, I take in all aspects of the dog's day to day living, but I also include their physical health, just finding out what their history is, as well as what could possibly be contributing factor to the dog's problem behavior. So it includes a functional analysis to ascertain the dog's comfort levels and to ensure the physical comfort is not adding to the dog's behavior. I do not do any kind of diagnosing. And what I do is I gather lots of information about the dog. I want to learn everything. I want to learn about the medical history, the diet, exercise, daily routines, and behaviors in order to help that dog and their guardians. So the process is initial introduction. I like to do discovery calls with clients that are looking for help. I do get referrals, and as well as I'd like to get vet history release. So possible issues might be relating to the behavior. The client completes a behavior questionnaire, and then I do up to a 90-minute Zoom consultation with the client just to go over the questionnaire and then look for if I see any holes or other things that I want to question. I can do that in the consult. Then I send the client a guide for taking stills and footage. So what the client then does is they collate everything and they send everything back to me. And then what I do is I go through absolutely everything. I collate what is important. I go through all the footage. I slow it down. I pull out anything that is relevant in regards to the stills and the edited film footage, as well as writing a text over of what I'm seeing. And then I complete a SOP report and then discuss the findings with the client so that they can take that to the veterinarian who can look further. So I do include a letter. I do include a SOP report. This is just it's usually one page SOP, and the second page may show some stills, as in this example. So I just write a really brief subjective to give you an overview of things that I'm seeing that could be suspicious in regards to discomfort, and then the objective in regards to everything that I did see in the stills and the videos that would be relevant to things going on structurally, and then just bullet point the assessment of everything that I saw. As far as plans are, the plan is to refer back to the veterinarian for their expertise so that you can look at possible issues, pain trials, imaging, or more, that is where the professional comes in. So the footage is, I typically cut 2 clips that are at relevant points. I upload them to YouTube for ease of watching, so there's no apps needed. I put the link in the covering email, or actually the letter, and all the irrelevant material is excluded. So I'm essentially just breaking it down and showing you just all the real relevant information in regards to static images, and breaking and condensing that into the SOP report. So what we do know in regards to discomfort, pain, and behavior, especially coming out of very large study, Daniel Mills et al. From February 2020. I do provide that link in my vet letter in case there are vets that are not familiar with that. But this study does show referral caseloads of several authors, and the prevalence in recent years that many of the conditions can be suspect from close observation of the patients, of possible discomfort and behavior issues, anywhere from 28%, which I know is low. Those are typically from medical issues, going up to 82%. So the higher percentage is often seen in regards to joint discomfort. So there's potential indicators of discomfort under 4 headings: presenting complaint as a direct manifestation of pain, unidentified pain underpinning secondary concerns without the initial behavior problem, exacerbation of one or more signs of problem behavior as a result of pain, adjunctive behavioral signs associated with pain. And what we know is, even going to the vet, that dogs can behave very differently in a practice setting. So getting an accurate assessment can be hard. Vet consultation times are limited. So this helps the professional. If you would like to, as a professional behavior consultant, like to have this add-on piece. Knowledge of the behavior often does not indicate the likely locations of the underlying problem. So the dynamic assessment helps pinpoint the location for professionals, experts to look at. And a lot of times, the guardian may not be able to articulate the problem well. They may see something, but they're not really sure. Sometimes they're unsure of how to provide that information. They don't want to be criticized because they know that they're definitely not a veterinarian. So this helps. The assessment can uncover facts, and it's basically, what can we see visually? So it's a huge benefit to the veterinary practice, a huge benefit to clients, and a great benefit for other professionals as well. It relieves time pressure, allows for more targeted investigation, and it gives an opportunity to work together with clients in a more collaborative way. So it takes a village. One of my own healthcare professionals once told me, when I wanted to see other healthcare professionals, and it opens up other avenues in regards to therapies where that might be appropriate. So, and when is a dynamic dog assessment relevant? And this is where clients may say it gets really aggressive when, can't understand it, no rhyme or reason. It's not every dog or person. It's if I go to touch her, resource guarding, hyperactivity. So, absolutely, the hyperactivity might be seen as jumping and mouthing, sound sensitivities, barking and lunging on the lead, pulling on the lead, stealing objects, counter surfing, anxious in car rides. So, some of the red flags that might contribute to this, there's lots of things, obviously, but a dog who lives, or a puppy who's grown up on slippery floors, repetitive activities like ball playing, frisbee, maybe some sports, and those dogs aren't managed by massage therapists or other therapies, and frequent car rides. So that can exacerbate or contribute to possible issues just from the dog not being secured properly in the car and constantly bracing themselves, as you can imagine. So I hope I kept this brief enough, and thank you for listening. This is how you can reach me, and this is my phone, texting 226-348-3948. You can also email me at walkaboutcanineconsulting@gmail, or walkaboutcanineconsulting.org, where you can also reach me through there. So thank you for listening.